All right, we have another fun case, so let's get into it. This is Alice. Alice is actually a super fun case because we get to combine some challenging orthodontics and also some really fun aspects of how we incorporate lasers and buildups into our practice so that we can keep things on track, on pace, and really make things look great at the end before it gets to the restorative dentist. So Alice was treated in 21 months. And again, we can see that Alice has some issues. We've got a little bit of a super class 1. She's got a little bit of a class 3 if we measure it out, a little bit of decreased lip support. You can see that those central incisors are nice. The laterals have this very small crown form. Some people call them peg. For some reason, I don't like that word, but who knows? I call it small crown form. Laterals and the canines aren't erupted. Again, anterior crossbite, lack of overjet, lack of overbite, and not a very nice smile arc. So we all know that this is going to be a case that we have to treat. And the good news is that when I laid this out, it wasn't truly a vertical case. Her mandible was nice. The mandibular planing was good. She had good chin projection. So this was more of a dental issue and maybe some tongue issues. But again, it doesn't help us. Just because the teeth are in the right spot doesn't mean that this is an easy case. We have to create room. We want to make sure that we don't increase the vertical because she doesn't have much overbite. And then we also have to get these canines into place. Also make room for the laterals. This is a case that's going to take some time. It took us about 21 months. Here's the end result. And, it's just super fun. So I can't wait to get into it with you guys. So we still always break things up into 3 phases, as you've seen in all my other cases. So we started out with Alice, in her pre-treatment records. And again, the goals were create space for the upper canines, create additional space for the upper laterals, develop the upper posteriorly, make sure that we improve the smile arc, and go from there. So braces went on. We used retrocline brackets on the upper because I knew that there was going to be some protrusion of the upper. And then I also knew that I was going to be wearing some light class 3 elastics, which is going to retract the lowers or recline them and then retrocline them. And then also it's a further advancement of the upper incisors. So I don't mind that in her because I want to give her some lip support, but I also don't want these front teeth to be proclined when we're done. So it took 12 months to get to roughly the progress point that we are now. We weren't in phase 1 because we had such slow eruption of the lower second bicuspids, and we also had a slow eruption of the upper left second bicuspid. But again, I wasn't worried about that. My entire goal of this treatment was to expand and develop the upper, make sure that we kept it in control the teeth as much as possible, improve the smile arc with nice arch leveling because she had a really good plane of occlusion. About, her occlusal plane was about 7 degrees, so it was not, by far a case that I didn't think we would get good smile arc on. And you can see at 12 months, which we always take 12-month records, even if we haven't finished phase 1. I'm really on my way here. So we didn't rush the process, and that's important because the lack of overjet and overbite, if we were to have bonded the upper canines prematurely, Newton's laws say that we would have erupted, but we would have also intruded potentially the anterior teeth slightly. It just made it a little bit more difficult. So definitely took our time, and you could see that things are looking quite nice. So about 5 months later, you can see now that the second bicuspids are in. We have them bracketed. We're in our 140275s. We're now creating space for the upper laterals. You can see that we've got some open coil springs between the canines and the lateral and the central. We had talked to the dentist in this case, and the restorative dentist wanted us to fairly much center those teeth, but also, which is a challenge in these cases, is he asked us to position that tooth slightly palatal so that they wouldn't have to create an overcontoured restoration or unnecessarily restore the centrals because they didn't have the room to prep the lateral. And this is where this next process comes in great. When we get done with phase 1, you can see it's exactly where we want it. We've got the overjet, overbite looking good. Again, we're not fully expressed here, so I'm not worried about exact alignment or torque expression. My issue coming out of phase 1 is foundation and direction only. I want rotations taken care of. First order should be fairly close. Again, the laterals will take care of that in the next step. You can see that our overjet, overbite, posterior dimension is great, and things are looking nice. So this is exactly where we want to be, even though it took 17 months. But the coolest part is knowing how this system works. I know that it's not going to take me long to finish this case from here. But there's a lot of components to manage. Posterior occlusion is great. Foundation is great. Direction is great. I really don't have much to worry about other than figuring out how to finish this case beautifully. And anybody who's done these cases know that this is difficult. Whenever you have spaces for laterals, I don't know if you're like me, but I'll retain the case, I'll send it to the dentist, and there's always a delay, whether it's insurance, financial, timing. Sometimes they do a gingival, sometimes they don't. Sometimes it comes back beautiful, sometimes it doesn't. More often than not, the case comes back and I've lost space around the lateral, or the dentist doesn't like it because the patient stopped wearing the retainer. There's a whole mess of problems that occur when we send this out of our office. And good luck to any office that says, well, I did my job and it looked good when you left, and then recharging them to fix what, was inevitably either a scheduling mistake, an insurance mistake, or just an issue with timing. So we do this all the time, and I want to show you what our process is. So again, really nice space. We've measured those with calipers. The dentist likes it, so we're good to go. So here's where our process differs, and I think that it's a really fun one to learn. Once we're done with phase 1, and again, 014, 018, 140275, went back to 018 because we grabbed the canines, 140275, 17 months. Again, it doesn't look the cleanest, however, it will get much cleaner moving forward. So here she is at phase 2. Remember, phase 2 in our cases are 180275 copper and eye tie, full expression. We do a repositioning appointment 6 weeks after we place them. Now, the coolest part about this is that in our process, at that repositioning appointment, that's also an idealizing appointment. So if we have a case like this, we're going to set her up for a little bit longer appointment. We're going to use a gingival a laser to trim the gingiva on the laterals. We're going to build these up temporarily, reposition any brackets, and then move into phase 3 with everything looking good. So let's look at this. This is 6 weeks after we placed the 180275 copper and eye tie. And again, I could have just been fine with this and said, you know what, when you're done, we're going to have your dentist, take care of all this. And I used to do that. But again, preserving the space, making sure it's perfect. A lot of the dentists that I work with, they do a great job, but I just don't know what that pathway looks like. And unless I send them over the same day the braces come off and they have a plan to get it restored right away, things usually have some hiccups. So here's how I solve those hiccup problems. So we go ahead and she comes in, we take off the brackets, we give her a little bit of anesthesia just so that we can do this. And then I trim the lateral incisor gum line. Now I'm not worried about the actual gum line. I want to over trim it a little bit so that I can get a good margin. And again, I always joke that everything I do is temporary. This is not going to be something that's permanent. And we're doing this to get a really good idea of what we need to do. Now, secondly, I build these up. I use a caliper to make sure that they're exactly the same width. You can see on the right side was nice. The left, I actually had a little bit too much space. Now, the second thing this does, not only makes it look better, but it also adds bulk to the facial so that when I replace the bracket, I now have pressure pushing that tooth back to the palate, which is what the dentist is going to need long-term to restore that with a final restoration. So this is what it looks like the day after, or the day of the procedure. We went ahead and we put the brackets back on, put the 180275 copper and eye tie in, put a piece of connecting chain under the wire so that we can close that up. And here's what it looks like 6 weeks later. That just looks amazing. And more importantly, now I'm set, right? Granted, I have a little bit of excessive gingival tissue that's over the canines. It's not perfect, but this is a nice margin. The dentist is super happy. My patient's thrilled. And more importantly, I don't have to worry about any inconsistency at the end. So this comes back in, we're at 20 months. At this point, we've got spaces closed. The bite looks nice. She's happy. And we set her up for removal just a month later. So phase 3 only lasted a month because we didn't need to do anything. We already had really great wires in. We just put some steel wires in so that we could make sure that we expressed everything and maybe settled it a little bit. Again, 1 month later, she's ready to get her braces off. And you can see phase 3 only lasted 1 month. 180275 stainless steel over 160275 steel. I had to do some class 3 settling elastics, which is it's a lower post to an upper 4 to an upper 6. It helps to settle the posterior occlusion. Again, this is just a week later, looking great. I love this just because now she can leave our office with a confident smile. I can let her leave the office knowing that with the retainers, I've done my job, everything looks awesome, and that now she can go to her restorative dentist. And I've already cleared this with a dentist. I get a couple questions about, does the dentist worry about the primary first bonding? And they don't. And the reason why is because I think there's just so many variables that can occur from the point where you leave the office with spaces to the point where we have this set now. So this is what it looks like the day after debond. Gums a little bit puffy. Patient's not in a hurry now to go to the dentist, so we can let these gums heal. and then the dentist can really properly manage the restorative in this case. And I don't have pictures of the final restorations, but once I do, I'll definitely make sure that I add them to the list. So we can look at the final review of records. X-rays look good. Wisdom teeth will be something we'd manage, in a year or two. 21 months before and after, was able to treat, this seemingly challenging case in a very predictable fashion, make her look great, make her have a really nice smile when we left, and really ease up that burden of running to the dentist and hopefully trying to get everything done in a matter of weeks so that we can not lose any of that space. So again, super happy patient, very happy parents, and a very happy dentist that referred to me. So from a standpoint, I'm happy checking this box. Again, if you like content like this, check us out, look at our socials, follow us, forward this to some friends. If there's something you want to see, make sure you send us a message and we'll put a case out there, okay? Have fun and always keep learning. Bye-bye.